Thanks for tuning into today's podcast. Before we begin, I'd like to tell you a little bit about our new remote training here at RPP. We've been offering remote training for quite some time, but we always required the athlete to come in-house for an assessment. Now we can do the whole assessment online and bring all of our services, pitching, hitting, and strength training to your doorstep. So, if you like what we do and how we do it, go to our website at rocklandpeakperformance.com and click on Remote Training in the toolbar. Thanks. The Behind the Seams podcast. I'm your host, Nunzio Signore, looking to bring you great dialogue with some of the best in the world of player development. The world of training baseball players has changed dramatically during the past few years, and I'm looking forward to shedding some light here on what's the latest, what's the best, and what's really happening in the world of player development. Thanks for joining me for the ride. Hey guys, welcome to another episode of Behind the Seams podcast. I'm Nunzio Signore, and today I've got my buddy Dr. Tyler White on the show. Dr. White is a chiropractor by trade, but specializes in sports therapy and human movement, specifically to baseball players, as I know him. He is a consultant in professional baseball, working with organizations and private clients alike. Tyler frequently lectures across the country on ways to improve performance and reduce injury in baseball pitching. His private clients range from high-end prospects to World Series MVPs and everywhere in between. Dr. White is the founder of the World Pitching Congress, one of the top baseball player development conferences in the country, and one actually that I've had the pleasure of speaking on. It brings together some of the top talent in baseball, rehab, and performance to educate the masses on how to keep athletes healthy and perform at their peak capabilities, which is a lot of what we're going to be talking about today. Dr. White is also an adjunct professor at Maryville University in St. Louis, Missouri, speaking in the exercise science program. These experiences are what sparked the desire to learn everything possible about baseball biomechanics and rehab, with the goal of preventing others from going through the same experience. Welcome to the show, Dr. Tyler White. What's up, Tyler?
Not much, Nunzio. Thanks for having me. Good to see you again.
Yeah, man. So my first question is, you said going through the same experiences. Can you first talk a bit about your history up to this point and your stint in college baseball?
So that is honestly, this is kind of it's going to be a therapy session. So my whole life, basically from the time I was 3 years old, was all about baseball, to the point of I have to do whatever I have to do to be a professional baseball player. That was the dream. Every day I woke up, I went to bed. You had one goal: you need to get 1% better. So going through that, all through grade school, all through high school, trying to get, better, trying to do whatever you had to do to get, signed Division I, get drafted, whatever it takes. Had some success, thought it was going to potentially lead into stuff like that. And then I actually just got done hitting, this is in high school, I just got done hitting the longest home run of my career, absolute bomb. Next at bat, take a step out of the box, feel a pop in my foot, cannot walk. I don't tell anybody. I mean, they know I'm hurt, but I don't tell anybody. I keep trying to play through it. Numbers decline. At this stage, there wasn't the Twitters and you couldn't, see how someone's performance was. So it was one of those deals where all these scouts that had seen me prior, like, oh, this guy declined significantly. He can't hit, he can't throw, he's not doing anything right. So I had to, I ended up walking on at a JUCO in my hometown, got healthy, performed really well. Sounded like I was probably going to be a starter as a freshman. First base, just hitting the crap out of the ball. Woke up one morning at the end of fall, couldn't lift my arm. No idea what happened. Nothing. They said, well, it's probably a rotator cuff or a labrum tear. And at that point, I was just distraught. I had no surgery, rehabbed it for 6 months, got healthy. But at that point, I was so frustrated for having, two significant injuries back-to-back years, pretty important years of trying to kind of set your tone in your direction, that I was like, you know what, screw this. I'm going to go to school. I'm going to figure out why this happened to me. And I'm going to take that same mentality of every day 1% better into the sports movement and sports medicine realm. And I knew I wanted to work directly with athletes to make them better, to essentially prevent anyone else from having what happened to me. If they want to live out their dream, get as much out of their body as they can, take it as far as they can, I want to allow them to do that. And it was all stemmed from me not getting that chance. So it was a hard probably a hard 5 or 6 years where I got to watch a lot of my buddies get drafted, play professional baseball, and I'm sitting there in a classroom for 12 hours a day, and studying all night, just trying to get through it. But in the end, I'd like to think I'm doing exactly what I was meant to do. I'm working with a lot of professional athletes and high end prospects, and high school kids and grade school kids that have the same mentality, the same potential, and it's fun to get to help change their potential careers. So at this point now, I'm really happy to be doing what I'm doing.
That's an interesting thing, because I always tell people all the time, I was a soccer player. That was my college sport. But everyone always, a lot of times, in our area, they're like, wow, that guy trains a lot of the high-end baseball players, and he never even played baseball. So you did play baseball, but your injury, like you said, made you have to choose another route while everybody else was playing baseball, which at the time seemed like a drag, which it probably was. But what it did was it made you have the time to sit down and actually learn how to train baseball players. And that's, I tell people all the time, you know what? I didn't play baseball. And while all these pitching coaches are sitting on the bench all summer, all fall, sitting there coaching games, which they're really good at because that's what they do, I read and studied about how to train baseball players to get better. So me not being a baseball player gave me the opportunity to have to go a little bit of the extra mile to figure out how to train them. It gave me the time. And for you, I guess, sometimes injuries are a blessing in disguise. It allowed you the time to start choosing your path early instead of going on that merry-go-round that a lot of guys end up in ball till they're 27 years old and then they're trying to figure out what to do. So
Yeah.
you also started you started a new company. Tell us a little bit about that.
Yeah. So in Invictus Performance Therapy, basically, I wanted to have. I had a previous company where we were partnered doing some other stuff, but it wasn't as nose deep as I wanted to be in baseball. So I kind of branched off, did my own thing, started my own company, and basically it's all baseball related. It's all baseball rehab. It's consulting both in working privately with players or consulting with organizations. And it's a lot of training, and it's a lot of what I call performance therapy. And that's where I come in, and essentially, if it's one-on-one type deal, I'm changing how these people move. I'm changing, what their compensation patterns are. I'm changing where they create power and force from, and I'm helping them move more efficiently, so that they can hopefully extend their careers and get the most out of their bodies as they can.
Great, man. So I have a couple questions for you that I'm going to talk about as far as lower back goes, because you're going to be able to help me with that when we get to that point with my athletes. But my first question really are, what are some of the big players, some standard principles that apply to all sports in regards to checking the boxes that need to be checked to help optimize performance? Like when a kid comes in on day one and you're looking for the lowest hanging fruit, give me 4 or 5 of the big players as somebody who studies movement and the spine. Just tell me 4 or 5 of the big players movement wise that you check out.
So, it's going to be a little bit different based off of their age, their skill set, and their sport. But some of the big, hey, everyone needs to be able to do this well, is you got to be able to control the center. Right. You got to be able to stabilize the spine. You got to be able to have your trunk and nice and control and functional and everything else. Because if you don't, you basically open up a Pandora's box of a million different compensation patterns that your brain's going to try to learn. And some people get lucky and their patterns help them. Maybe they stress certain areas that they can play longer on without them breaking down. Some go into compensation patterns where they break down almost right away. Like I hate to say it, but I have some 11 and 12-year-olds, in the office right now that have injuries that you shouldn't see at that age.
I was gonna say that, like that stabilization of the spine, that's especially crazy hard when you're dealing with young kids that are still growing.
Yeah, absolutely. So and then again, it's age matters, their skill set matters. A lot of this. How much did you start playing at a young age? Did you start playing a month ago? Like those things come into play when looking at that. General range of motion is another big one, a big player. Like if you can't move well through how your joints move, you're gonna find ways around it, and sometimes it's not in a good way. What else? Muscle tone's another big one. But again, these all kind of come together.
Right.
Like, you got to be able to control the segments. You got to have decent muscle tone so that you're not, too tight on one side and too inhibited on the other, and then all of a sudden you get this imbalance, and then you go down another compensation path. And the thing is, like, it all kind of originates around how the trunk works.
Exactly.
Right?
Yeah, I got guys all the time. Fathers like, he needs to learn how to use his lower half. He needs to learn how to use his lower half. It all starts from the bottom. It really doesn't all start from the bottom. It all starts from the middle, and you send it to the bottom.
100%.
And that's what everybody fails to realize. When you can't control what you're doing, proximal to distal, things start to move, and then kids get really good at what they practice, and then guys give them a bunch of throwing drills, and now they still can't move right yet, so they're doing the throwing drills wrong, and they're getting really good at moving poorly, right?
Exactly.
So,
Yeah, no, I had a pitching coach talk to me the other day about, we were talking about back foot loading and how to basically grip the ground using intrinsic foot muscles, and like how to train that in different movement patterns. And he's like, why don't you do that right away if that's their issue? And I said, because if we don't train the pelvis and the trunk first, then you're going to open yourself up to 100 different ways to fail that movement. And
exactly.
we got to get that center down first.
Yeah, we installed last year. We installed a Proteus machine, and it's a great machine to help guys feel digging into the ground with their feet, that clawback mechanism, and just getting solid on their feet before they move. But what happens is, because it's a new pattern, the guys that don't have good core control, when we first try to assess them on the machine, their feet are going all over the place. And it's not that they can't control the ground with their feet. They haven't been able to control a constant resistance to a full range of motion. They haven't been able to control that with their core. So they can't actually send it down and stabilize the spine, and the legs are going all over the place. And honestly, within 5 or 6 reps, you can start to see them focusing on their core. You could start to see the feet standing still in the ground as soon as they figure out, oh, okay, I got this now. Proprioceptively, they feel what's going on, and they're able to use their core better. But when it throws them off, if their core's not strong, they go flying. You know what I mean? So that's, as far as stabilization goes, that brings me to my next question. I saw a tweet you did on Twitter about a week ago. You talked about the importance of sequencing while learning stabilization strategies. Can you touch on that a bit, and why it's so important, how you go about doing that? Because I found it fascinating, and I actually wanted to hear more about it.
So there's a couple different areas that this kind of goes into. One is, in terms of that particular tweet, sequencing was referring to movement that then integrates into the pitching motion, right? So you can take the same mentality to kicking a football, or to, you name the sport, some type of action, some type of movement you're trying to achieve. We're trying to sequence those movements to find the proper stability patterns to emit the most force in a functional way that doesn't stress all the joints and segments and muscles leading up to what's used in that motion. So it's the deep origins of it are based off of like developmental kinesiology, essentially how a baby learns to move through the first 3 to 16 months of their life. You do not teach a baby the proper, rolling and then cross crawl pattern movements, and then upright, and then squatting and standing, and and then ambulation. We don't teach them that. Their brain automatically learns how to do that. So deep seated, we have these intrinsic pathways and activation patterns to get the proper sequencing to stabilize a joint and to do what it needs to do to what we call joint centration, where the joint is centered and the muscles all fire together so that it's not too far imbalanced one side or the other. It protects the muscles, protects the connective tissue, protects the ligaments, muscle, joints, everything. So deep-seated, that's kind of where a lot of the origins of this come from. Now let's take it into pitching. So if you're looking at, we'll say, starting with a windup, based off of, and again, this also is determinant on the individual athlete, because everyone develops differently, right? Their bones are different lengths. They have, anteverted hips, retroverted hips. They might have a wider pelvis, a more narrow pelvis. They might be taller, they might be shorter, whatever. So it's going to change a little bit about how their body wants to move, but you take them through those motions. And essentially, if you can train them, say, with their hip at a 45-degree angle in a closed chain position, now they can activate the right muscles that stabilize the hip, that create the kind of the propelling force off the mound going into the stride phase, right? And now let's say we bring them at 90 degrees. You can do the same thing with a rolling motion. So now you get all the muscles to keep the joint centered and to be able to stay there as they go down the mound, because you've trained the strength and ability for them to fire the right muscles. The problem comes in, and this is a national thing on the baseball level, is too commonly we're training some of these guys and we're not looking at the muscles that they fire when they do these motions and movements. And we're adding strength on dysfunctional patterns, or we're adding strengths into their compensation patterns, which then develops, hey, now we have more problems going down the way.
That's
If
the
we can
getting good
fix
at
it-
moving poorly. That's the getting good at moving poorly.
Exactly. So if we can fix that foundation early, then by the time we build that house to the highest it can get, it's not leaning at a 45-degree angle. It's going as straight and it's strong and sturdy and everything looks great. So we have to make sure early on that movement looks good before we load it and we add more stress and we add more strength and we add more force, all of that. So when it goes into the sequencing of it, they have to be able to get the basics of static posture stability. So can they statically, let's talk shoulder for a second. Can you statically create shoulder stability without overcompensating, we'll say, the anterior shoulder? So the pec, coracobrachialis, some of the muscles you see commonly tied in throwers that don't have proper scap stabilization. They're going to be really rigid in those motions. Can you hold that without activating those muscles? Great. Now let's progress you to an upward rotation position. Can you go in upward rotation and do the exact same stabilization without compensating to these kind of more rigid areas that you tend to use as a thrower?
Do you tend to use do you tend to use perturbations with these to get them to stabilize in different positions? When you say
no, I will start all closed chain. I will initiate everything closed chain first, because if you go open chain,
explain to our viewers that might not know closed chain and open chain.
So closed chain, basically you have some type of stable surface that the brain now is utilizing as like it's like you're standing, right? You have the ground to move from. But open chain, now there's nothing that you're using as a stable base. Like moving your arm, doing like a overhead dumbbell press or something is open chain. But if you're doing a push-up, the ground's not moving, you're moving your body on the ground. That's a closed chain. So think of it like this: a bicep. We'll talk about the hamstring for a second. If you fire the hamstring, it's flexing the knee in an open chain scenario. But if you're closed chain, standing stationary on the ground, you fire the hamstring, it's actually going to be a trunk uprighter. So it's going to help upright the trunk. You're basically reversing the muscle origin insertion on the way it acts.
Right.
So that's how, exactly. So that's how we start with the sequencing phase. Is I need them to understand how to control that in a closed chain setting first. And because that's how the brain is going to learn to fire those little muscles that control these joints.
Yeah, that's
instead
the baby.
Of the big.
That's the baby crawling.
Exactly, because what happens is if we are open chain right away, they're going to go to their compensation patterns,
or fall.
They're going to go to yeah. They're going to go to the bigger muscles, the lats, the pecs, the stuff that they can propel that are multi-joint muscles. We gotta focus on little ones first, so that the brain knows how to control the joint itself. So then once they start to establish strength from a more static based position, where they're using the little muscles and not the big muscles, now the brain's starting to understand what to do, then we go into the dynamic functional training, where we add more rotation, where we add more actual movement based, where basically they have to keep that joint centered. All the muscles have to contract together at a very specific amplitude to not to like be so far one way or so far the other way. They're basically controlling so that it stays right in the center through these different motions. That's when it's like, hey, this individual is ready to go. Let's go throw them a bunch of open chain stuff. The brain knows how to get everything moving well, and then floodgates open.
Right. That's like I remember I heard Stuart McGill talk one time, and he was talking about how bodybuilders love to train the big back muscles, but they don't want to train the multifidi and all the smaller stabilizing muscles. Same thing that I always see people doing rotator cuff strengthening, but nobody ever works on stabilizing at the firing time of the cuff. It's the same thing with the what you're talking about with like back muscles. These bodybuilders, they have these huge, gigantic, strong backs, and they're always in debilitating back pain because the small stabilizing muscles are still not stabilizing. So it's almost like you got these beach muscles around they kind of worked it inverse. They worked on the roof before they built the foundation. You know what I mean?
Exactly. That's exactly it.
So that's a really, really great point about stabilization strategies in closed chain positions in the pitching movement, which I think is a really, really good one. It's hard sometimes, though, to get the buy-in from young athletes when you want them to try to work on stuff that's training the stabilizing muscles. And you know how it is when you got college guys and high school guys in here. They just want to come in and they want to get after it, and they don't want to talk about doing a bird dog. You try to get them to do a bird dog so they can get some stabilization of their spine in a contralateral movement, and they don't want to do it. They want to, they want beach abs. So one thing they all seem to understand and take seriously is spin rate and velo. If I want a guy to buy into what I'm doing, I just have to tell him, this is going to make you throw harder. This is going to increase your spin rate. All of a sudden, if I have a kid that comes in and he's just kyphotic with rounded shoulders, and then his father keeps saying, I tell him to sit up. He never wants to listen. He goes, I said, he doesn't care about posture. He doesn't care about stabilization. If you tell him that he'll throw harder, if he gets better posture, he'll walk around all day like that. And it does work. So can you please talk about how improving ranges of motion can help optimize? Let's just use spin rate. I talk about with my guys, listen, man, if you have a strong core and you can stabilize your spine, you can get more extension out in front. As longer you can stay on the ball, you can come down with more leverage on that ball. That's going to increase your vertical break. That's going to give us better spin rate. And a lot of times that is the only thing I can do sometimes to make these kids understand that you don't want just beach abs. You know what I mean? We got to train the oblique sling. They don't want to hear about it. But when you talk about more vertical break on your curveball, all of a sudden they're doing it. You know what I mean? Mm-hmm. So please talk to the audience right now. Give me some examples of how good movement patterns can help a kid throw harder.
Yeah, so it's one of those scenarios where if you're compensating with your movements and you're using kind of all upper body, right? And you're, like you said, you're not utilizing the middle, you're not using the oblique slings, there's no lower half activation, or there is lower half activation, and then you'll lose a huge energy leak in the center because the trunk and the spine is not properly sequencing to get it to the arm. You're going to make up for it all in the arm. Things are going to start maybe breaking down, or you're not using all of your capabilities. So what happens there is, again, like you said, your spin rate can go down, your velo can go down, or just moving better, it's going to potentially go up. Now, it's not guaranteed, but it's one of those deals where, hey, if we can get things moving better, it's not uncommon to see a hike in spin rate, 2 or 3 mile per hour hike in velo. The biggest thing that I tell guys, especially when they come to me, like maybe a little bit banged up, is, hey, we can keep you on the field longer. Right. Hey, you might throw harder and you might have higher spin rate, which is great, but hey, it doesn't mean anything if you can't stay out there.
Right.
So it's a little bit two pronged. Like, yeah, it's great. You get a performance gain when you start moving better and you're using your body efficiently. But let's look at the bigger picture of, you get to use that new weapon for longer. So yeah. that's kind of a big deal.
Let's keep the best 9 guys on the field all season. You know what I mean? It's not who's got the best guys. It's who can keep the best guys on the field. You know what I mean? And that's huge. I'm going to talk a little bit about assessing, because we have a big assessment that we do. And I know that you're really, like, coming from the chiropractic field. I have a couple questions for my own personal this is a little bit selfish of me, but I have some questions I want to ask you. When you see poor hamstring length and say a supine active straight leg raise during the assessment, what's your thought process you go through when assessing out what the actual culprit may be? I can tell you that for me, I have a lot of young kids come in and they're in complete anterior pelvic tilt. Okay. So their hamstrings are on. What is the process that you go through to tell, are these hamstring tight because they're long, or are they tight because they're authentically tight? Can you take me through the process when a kid comes up and he's showing like a 45, 50 degree active straight leg raise? What is your thought process of what's causing this tightness? Can you take me through the protocol?
Yeah, so I immediately in that scenario am looking at 3 or 4 different regions outside of just the hamstring alone, right? Like the hamstrings, obviously, hey, that's our main bullseye potentially, but you got to look at, like you said, what's the pelvis doing? What's the pelvis position naturally? Is there a heavy anterior tilt? And then that leads into another question. If that is the case, why is that anterior tilt there? Is it
Right.
is it a hip flexor issue? Is it a quad based issue? Is it an inhibition in the abdominals? That's one thing that I've gotten like really heavy in over the last year, is like looking at like the lower third of the abdominal muscle as it activates and controls the pelvic position. Can they create proper intra-abdominal pressure to stabilize the spine so that the pelvis doesn't dump in that position? Like just that right there, there's 5 or 6 things just off of the front side, not even looking at the hamstring.
So you're talking about the anterior abs, the lower portion, fighting over the pelvis with the hip flexors. Are you talking about who's winning that battle?
Exactly. Yeah. So if that ab is not, if the lower 1/3 of the ab is not activating much, and we'll say it's inhibited, it's just not firing. And then, we'll say they're very quad dominant, and the quad attaches to the pelvis, and then, or one portion of the quad attaches to the pelvis, and then hip flexor gets a little bit tight, that those might be doing all the work, and you have no balance to pull out of that. It's all one direction, not enough in the other to create a more balance of how the pelvis works. So that 100% can be an issue.
So how are you testing? So how are you testing whether it's the lower abs or the actual hip flexor?
Well, so I'll put them in a couple different positions. We'll go on their back and supine first. Maybe I'll have them bring their knees up, and I'll do like just a resistive muscle test to see how that activates and how kind of their resistance is, how much strength there's there. And then we might do the same with the quad to see how the quad tension is. And then the other thing is, like, I might do a more passive range of motion of the pelvis, where I just kind of take, or not the pelvis, but the hip, where I take the leg and just kind of see how they work together, and to get a better understanding of where their tension might lie when they're relaxed. And then from there, we might do like a leg lowering test, or like a lower abdominal eccentric, to see if they can maintain that tone for even 10, 15 seconds. And a lot of times when they have that heavy anterior tilt, that dump, they can't. So it's like, boom,
you'll see the
already
arch.
we know.
Yeah.
Exactly.
Right.
But again, that's getting the cart before the horse. We still got to make sure that they can create spinal stabilization before we even look at any of that other stuff. Because if they can't create pressure in the center, that's that compensation right there that we just talked about a minute ago. Like,
that's cool. That's cool, because that's exactly when we have guys like, let's transfer the hamstring to impingement. When we bring a guy up when we bring a guy's leg up and to see if he's impinging, and he's got pinching, and we know he has an anterior pelvic tilt, a lot of times I'll tell him, listen, man, tighten up your glutes and tighten up your abs. And it makes him kind of posteriorly tilt while he's in supine. And then we test again, and there's no pinching. It's because we're kind of addressing that anterior pelvic tilt immediately, and seeing if that gets him out of it. That's what you're talking about with moving with the center.
Yep, exactly. And then the other thing with kind of that, what you just mentioned, they might be able to get proper activation of the glutes and hamstrings and get them in that position, but maybe it is that one missing component could be that lower abdominal portion, where maybe a better cue for that individual would be bring your belt buckle to your belly button, so that their brain thinks front side, right? They think it's the front side of the body. to create that posterior tilt, so that the abs are the main, or the lower third of the ab is the main moving force to get them into that position.
Right.
That might change everything.
That's great. Changing wheels here. I find that the durability recently in high school athletes that come into my facility in particular has changed drastically. Why do you think we're seeing such a lack of durability? And what are some things we can do to help change that, or at least make it better with these young guys? I really see, whether it's they're not playing multiple sports, or I don't know what it is, but these kids, like as soon as throwing starts, I'll see kids a lot of times with lower back pain. When I was a kid, I didn't know any kids that had lower back pain. Maybe they did and you didn't hear about it. There's a lot of kids walking around with lower back pain. They're like 15 years old. I'm like, how did that happen? What do you contribute this lack of durability to?
I don't know that I can pinpoint one thing. Yeah. There's several factors. And you mentioned a good one with like the single sport deal. And like, I'm a big fan of, once you know that's your sport, you stick with it till you're so good that you're as good as possible. But there is a factor to doing the activating the same muscle or muscle groups in a sequence over and over and over and over and over, rather than switching it up and changing up the pattern, because baseball is very rotational, and then football might be very sagittal plane based, and it changes what muscles fire and whatnot. So there is a factor to that. I think we do see a lot of people sitting now. It was back at my back when I was in high school as well, but I feel like it's getting a little bit worse with the amount of technology, how easy it is to have computers and laptops and everything. And I think one component that's affecting a lot of different categories, not just like sports and exercise and fitness and whatnot, is the COVID years. Like there's a lot of weird, people were stuck inside. They weren't able to go do their normal routine. We had a solid year where everything was different, and then a year of like transitioning back. And you just see that people weren't moving well. And like you said, maybe their back's hurting because they jump into a training program that might be a little bit too heavy, when their brain doesn't know how to move well because they didn't do anything for 8 to 12 months.
There was no tissue prep before training either.
Exactly. So I'm wondering if there's probably some carryover from that as well.
Well, there's another thing that I find that we have a big ice hockey population here in North Bergen in New Jersey, and in Rockland County, New York, and we have really great ice hockey teams. And I noticed that they'll take it all the way to the end of states, and then they'll go upstate and they'll get their asses kicked by the country boys. Right. And I attribute that to country boys do chores. Okay. They move all the time, whether they're taking out the trash, or I got a bunch of, I'm 12 miles from New York City. So we are pretty much an urban group of young kids here who get driven to school, take the bus, do this, do that, come home, do homework, go to school, train baseball. And they do that same movement that you're talking about over and over and over again. Don't play multiple sports. Whereas we got kids upstate, they're big, they eat a lot, they eat good food, they take out the trash, they may cut the grass. A lot of my guys don't do that. You know what I mean? Mm-hmm. And I think that fascia is not moving like it should be, and not getting fed in all different ways, all the different slings, whether it's the spiral line or the front line or the back line. I think when you do that, I think you start to work and you start to move better. And I think a lot of times I can attribute that to back in the day, maybe the kids weren't so spoiled, you know what I mean? And they had to do other stuff, or we climbed trees or something, but we did something to move in all different ways. So moving those movement patterns over and over again is a huge one. And sitting in kyphotic.
It's funny because like hearing that, you kind of think like it's a little bit of like back in my day, get off my lawn mentality, but I think you're exactly right. Like I see that. So, and I'm in a similar, so the location I'm in right now is about 30 minutes outside of St. Louis. It's a very affluent, wealthy area.
Exactly.
And it's a lot of people that, you see guys that will spend all their time training and doing all that, or again, they don't have to do chores or do other stuff. So it's like, Yeah, I 100% can see that being the case.
Yeah, it's huge. I notice it. I'm like, okay, they're going to go upstate, and these boys are going to be coming right out of like mowing the lawn, and they're going to go to the game, and they're
Hmm.
like completely opened up. You know what I mean? Where our guys are like, so I try to use fascial circuits every day with my guys and to get them to move in all the ways that they never move. That's the first thing, kind of like dynamic systems like Franz Bosch, right? Kind of like
Yeah.
getting guys to move in ways that they don't always move. And that's that stabilization techniques that you're kind of talking about too, getting guys to be able to react with their entire body. So that's great, man. Really, really cool. When it comes to managing pain, I personally like to slow the tempo down and use isometric holds to kind of sift through where the problem may lie. Do you use isometric training with an athlete who's rehabbing, say, an ACL or low back pain, for example? And if you do, what are some exercises you use for maybe a kid who's experiencing knee pain? Like some isometrics that you would do. Once again, this is a question that I'm asking because I do have guys that once in a while they have ACL problems. It's not always shoulder and low back, and I'd like to kind of know. Give me two good big bang for the buck isometrics that you do with your guys to help them learn how to get back into in better positions.
Okay. So if you're looking at knee, um, well, the one thing, obviously the Nordic and reverse Nordic are very good for quad and hamstring. If you're looking at well, maybe not isometric, but an eccentric. Um,
Eccentric. Honestly, that's what I'm talking about.
Yeah.
Eccentric.
So, when it comes to pain, I would always start by getting the tissue quality, getting the inflammation, swelling, and pain down first, and then going to an isometric, and then going to an eccentric. That way, they can take that tissue length and loading. Those two are really good for around the knee, but also you got to think if it's a knee issue, odds are the hips aren't great. So you got to look at what's happening on the hip stabilizing muscles. So like glute medius, glute minimus, some of the ones on the lateral side that do hip abduction, those are commonly inhibited in guys that have knee issues. I would maybe do like what's called like a side bridge, where they're on their forearm and then
Yep.
also on their knee, and then they'll come up into like a full
Yes.
abduction position, and they'll hold that. And if they can hold that position for we'll say 30 seconds to a minute, then we can start doing some eccentrics or just some regular eccentric concentric reps in that phase. But you got to be able to graduate to holding it first before we can go to reps, because I got to make sure you don't cheat the pattern and then create more problems later on for me to fix.
Great. 30-second side bridge to judge if eccentrics are justified or not. That's a good one. That's really good. What about you guys? What about guys that for the first time in 15 years of owning a gym in a private sector, I have a few guys this summer, college guys, that complained of lower back pain. It didn't really start until throwing started. So I didn't really attribute it to the strength training because I've never really experienced that before. But once hard throwing started, these guys started to experience lower back pain. Like I don't know if it's a hypermobile SI joint. I don't know if it's some sort of bulging disc or whatever, but I've never experienced 3 or 4 guys in a summer that are all having lower back pain. And it made me go back and go, wow, is there too much volume in the program? And we looked and we're like, no, you know what? We've been doing this program right now for about 4 or 5 years and no one has had back pain. This year, 3 guys. And I don't know if it's just a coincidence, but it happened all 3 or 4 guys. It happened once hard throwing started, even with a ramp up. You know what I mean? Even with a good ramp up. So I'm attributing that to something that's happening in mechanics, maybe. But
Mhm.
what's your thought on that?
Um, So initially, I would say you need to make sure that there's not something pathologic going on, right? Or structural. So maybe see like a PT or a chiro to get assessed. Like if it's a disc herniation, is there some type of like stenosis? Is there some type of spondylolisthesis? Because that's going to change the direction on how you train. It's going to change the direction on how you rehab. It's going to change the direction on how you work on their mechanics significantly. So like one, if it's a disc issue, they're going to have problems going into flexion. If it's an extension, or if it's a stenosis or spondylolisthesis issue, they're going to have problems going into extension, which then when that starts to happen, or when those tend to be the case, you're going to see common patterns in muscle overuse or hypertonicity, right? So the erectors, the low back straps are going to get too tight.
Right.
They might be really tight in their QLs. They might, again, have weakness in the abs, or they might be overusing them. Might be a hip flexor issue as well that's putting you into that hyperextension in your low back. There's so many different nuances and caveats to it.
Yes, and a lot of these, all three of these guys, they're not that bad with an anterior pelvic tilt, but they do have tight QL. All of them, all of them. I guess they're compensating.
So that's exactly it. I would say if they're tight in the QL, they're probably over leveraging the actual the facets of the spinal joint to rotate, rather than their whole center and their slings. So they're leveraging the backside to create rotation rather than the entire abdominal cavity and the whole kind of trunk region.
Right.
More than likely, that's where they're compensating into. But again, you got to look at what's the rest of the pelvis and trunk look like. Where are they weak? Where are they tight? Where do they not know how to create strength and power from? Like they're going to fall to their compensation pattern every time.
It's proximal to distal again. It's that goes
exactly
right back to that spinal stability is everything, you know?
And then what's stability at that point?
Yeah.
If they're all posterior tight, that tells us the anterior side's weak. So we got to create just balance amongst the center.
Right. So I remember, I don't remember who it was, but a great way to describe what you were just talking about with spinal stability is an umbrella in an umbrella stand. People, when you think of your core, all they think about is their front. All they think about is their abs, right? So I tell people, if this is an umbrella, if I have an umbrella in an umbrella stand, I need the umbrella is my spine and the stand is my pelvis. I need that spine to be centered and stable so it doesn't move forward, backwards, or side to side, right? You need the core holding that stable the whole time. So if you just strengthen the front, it's going to fall to the back or the sides. If you just strengthen the back, it's going to fall to the front. If you just work on rotary stability, it's going to fall to the front or back. So working on one aspect of your core doesn't mean that you're going to get spinal stability. I think that's you just brought up a point. If you're posterior, that means your anterior is falling apart, you know? So work, guys, messages when you're doing core work, you need to figure out, you need to work on lateral stability. You need to work on rotational stability. You need to work on anterior core strength as well. You need to work on it all. So
exactly.
Kudos to you for making me remember that. I know you also strength train your athletes as well. How do you determine when the athlete is strong enough for the task he needs to do, and when we may be reaching diminishing returns? For example, for us, if I find a guy who is deadlifting 2.5 times his body weight, that's good for me to throw a 5-ounce baseball. I need to start working on some other things that maybe he needs to work on. How do you determine the lowest hanging fruit as far as strength goes, and what needs to be done? And is it just upper body? What do you do to figure out if a guy is actually strong enough that maybe we might need to start working on rate of force production at that point?
Yeah, so I actually don't do a whole lot of strength training on my own, like with the athletes. I have so many good trainers in this area, and like yourself all across the United States, that if I have an athlete in that area, I know I can refer to them, and I know that they're going to know what they're doing. I'll say in my strength side, like I have a background in it, and if I wanted to, I could. but my brain says I need to focus on this piece. And if I dabble too much in this piece, I'm going to lose kind of what I feel like I have a unique ability to do. So I don't want to be
Right.
too
The jack
jack
of
of
all
all
trades
trades,
thing.
master of
Yeah.
none,
Yeah.
bingo.
Exactly. Good.
So my mentality is, let's make sure that they can move in a way and activate muscles in a way to be able to do those particular lifts and programs that the trainers, the strength guys want them to be able to do. So like you mentioned, the 2x body lift on, or 2.5x body weight on deadlift. If they're doing that, great. But if they're doing it in a pattern that's not good, that they're building, strength on
Yeah.
a
Yeah.
compensation pattern,
Yeah,
that's what I look at.
that's worth talking about, but I wouldn't. What I'm talking about is 2.5 times body weight with good form. Bad form is just not even in the equation. So, but yeah.
So my
Well,
brain goes to, let's clean up the form first, and then I work with the strength guy to make sure that we're doing everything right.
great. Okay, cool. So I'm probably going to nix that question. Okay. So finally, I'm constantly trying to reinvent myself. What is something that you have recently changed your opinion on, and how you now go about doing it, and why?
That's always a good question, because there's so many like nuances to a belief, and like I guess it wouldn't be changing, but maybe a perspective change, not just like a
Right.
total mindset change.
Yeah. That's a change,
Like
though, to me. That's what I'm talking about.
yeah. So I would say, like, I feel like I'm trying to look deeper now at what I thought was like the way or the idea or the model. Like now I take what I used to look at every day with a pitcher or with an athlete or whatever, and I try to divulge deeper, or not divulge, but like bring it a little bit deeper into. So like I'll give you an example. Looking at, like we just talked about, the lower third of the abdominal muscle in an imbalance around the trunk. One thing that like too many people put together is like that muscle contracts, it flexes your trunk. It has a couple other movements. If you reverse it, it works on bringing your pelvis into anterior tilt. But if you also think about that muscle, like the contraction, the position that your pelvis is in when a certain portion of it contracts, the amplitude of the muscle contraction. Like if you look at the abs, there's separations. That's how you get your actual like six-pack abs. So those separations create a slight contraction difference from the top ones to the bottom ones, and what they move. And then the position they're in to get the most optimal activation out of them is unique. And I think that's where like my brain started to say, like, okay, if I put them in this position, but I shut off this muscle, I can get the most out of this to train the brain to activate it more efficiently. And it's like, I think I'm just starting to look a little bit deeper into my process, and trying to advance, like I said, 1% better every day. Why is this unique? Why is this probably something going on that we need to look at?
That's awesome, man. This has been a incredible learning experience for me. A couple things I really loved was, I love the 30-second side bridge to determine if it's eccentrics are justified yet. I really loved that. I also loved the slow eccentric leg lowering to see if the lower abs can handle it, to test if we've got a lower ab impairment. I love those two things. We've been talking with Tyler White, Dr. Tyler White. How can they reach you?
Any of the social media platforms, mostly Twitter. I'm on Instagram as well. You can go to my website, invictusperformancetherapy.com. It's a lot of letters and it's a mouthful, but you start typing it, it'll be there.
Awesome. And guys, you can reach me at Nunzio Signore on Twitter. At RPP _baseball is my facility on both Twitter and Instagram. My website is www.rocklandpeakperformance.com. And if you haven't checked out my book on VBT, velocity-based training, how to apply science, technology, and data to maximize performance, you can get it on Amazon. It's published by Human Kinetics. And I'd really, really like to thank Tyler White. We were going to get him on a couple of weeks ago, but unfortunately, I got the COVID. So I'm really glad we got him on. It's always great talking with this guy. I love when I see him on the tours of speaking. And guys, looking forward to catching you on the next one. Thanks, Tyler. Thanks a lot.
Thanks, Nunzio.
Hold on for 1 sec. I'm going to just stop recording.